review some TMJ stretches to help with jaw pain, also can help with some headaches, and we're going to review some neck stretches as well. So, Kat, the first one that we're going to do is the sphenoid release. And so what you want to do is find that little dip above your cheekbone here where it's soft, and put your fingers there. You can lean on your elbows if you want to, or you can sit like that, however you're more comfortable. If you're leaning on the table with your elbows, that might give you a little bit more support. But I want you just to press in there. Don't go through your skull. We don't need to press on your brain. Just gently hold right there. And what you're going to do on your own is hold it for at least 2 minutes, 2 to 5, okay? Sometimes that area can be tender, so you don't want it to be really painful. You just want to apply that pressure, okay? And so again, that's the sphenoid release. I was doing it for you, with you. All right, and so she's going to hold that for 2 minutes. When you do it on your own, I want you to hold it for at least 2 minutes, maybe even 5. Okay, somewhere between 2 and 5 minutes. All right, so now we're going to do the next one. The next one is called Maxillary Decompression. Super easy. You want to use the heel of your hands, put them underneath your cheekbone. Again, you can lean your elbows into the table, and it's the same kind of thing that you would do when you were tired at your desk, and you just rest your cheekbones into the heel of your hand. And again, mild upward pressure without sliding. You're not going to slide on the skin. You're just applying that pressure, elbows supported on the table, and this hold for 4 to 5 minutes. Should not be painful. Okay? Good. The next one is the Tmj stretch, and there are 3 steps to this one, so we'll do it one at a time. First thing you're going to do is put the palms of your hands on your cheeks in front of your ears, here on your face. Softly compress your hands into your cheeks and pulling your jaw downward at the same time, so pushing in and pulling down. Be sure not to slide on the skin, so you're not doing this. You're going to keep that same position. You anchor in and then slowly lower, not sliding on the skin. The next thing is you're going to rest your fingers on the lower jaw, so kind of the same thing, but you want to hold here and then pull down. So you're pulling the lower jaw away from the upper jaw. And then the third part is pressing your fingertips gently into the jaw muscles here, and you can feel them move when you move your mouth. Press here and hold this one for 2 to 5 minutes. And you'll feel it, if you're real still, you can feel it soften under your fingertips. That's what you want to feel for. And even if this is tender when you start, after a couple of minutes, that should ease up even with the same pressure. Okay? Next, ear pull, hair pull. It's exactly what it sounds like. You want to put your, again, you can rest your elbows on the tabletop just to give yourself some pressure, some support. Grip your ears between your index finger and your thumb. Allow your head to drop down like you're reading a newspaper. Create a gentle pull out, away from your head and back. So out and back. Let your head and cheeks rest in your hands. And this one you're going to also hold for 2 to 5 minutes, for allowing for several releases. You can also create a gentle hair pull using the same position. You grab large clumps of hair, so put your fingers in your hair. Yep, that would be good. Right, and so it's almost like you want to massage your scalp, but you're just going to come in, hold, grab your hair, and just pull lightly. This should feel good. This should not hurt. Okay? Good. Okay. And then lastly, the pterygoid releases, the self-pterygoid releases. When you do the pterygoid release, you're gonna put your finger in your mouth. If you wanna wear a glove, you can do that. Okay, and so you're gonna put your finger on along the top jaw, just above your teeth, along the gum line, and come back until you feel that muscle right there. So on the outside, it looks like this. You're gonna come in and you're gonna feel that muscle right here at your jaw on the inside and stop there. But you're not gonna, you're just gonna push into it. So you're gonna apply some pressure. With TMJ, this is usually tender, but try to hold it. Try to hold consistent pressure. You don't have to, use all of your might, but you should put a fair amount of pressure there. And hold that. And after a couple of minutes, and hold it for as long as 5 or more, you'll feel that it almost feels like your jaw, but it's not. That muscle is really tight, and then that muscle will start to soften and it sort of melts away, so you don't feel it anymore. What you can feel, once that melts away, you should actually feel the side of your tongue there, okay? And you want to do that on both sides. Even if only one side is painful, you still want to do both sides.